So next up, we've got Dr. Ariana Arulampalam. She's representing ACRRRM today. She's a rural generalist, generalist GP obstetrician based in Cowra. And she works in general practice, nursing homes, and the emergency department in Cowra, and in obstetrics and gynecology in Orange, embracing the diversity and challenges of rural medicine. So please welcome her on stage.
So my name's Ariana. I'm a medical educator with ACRRRM, and I'm here to talk to you a little bit about the process if you would like to become a FACRRM. So I'd just like to acknowledge the Aboriginal and Torres Strait Islander people that we're meeting on their land today. I've come from Wiradjuri land and I've crossed a border to get here, and I just wanted to pay my respects to elders past, present and emerging. All right, so what is a rural generalist? So rural generalists are doctors who have additional skills and expertise to provide medical care in regional, rural and remote communities. All RGs look different. None of us are the same. We all have different interests and passions which have brought us to be in various places around Australia, and you can really follow whatever path you choose to become a doctor in rural medicine, and it's going to make a difference to that community. Why choose us? So ACRRRM is all about training you to be the right doctor in the right place and at the right time. The training is flexible so that you can become the doctor that your community might need, or you might want to follow a particular passion and then find a place to be. We have the ability to give you an extended skill so that you will have your general practice work as well as an additional skill which might be procedural or not, depending on what your passions are. And ACRRRM training really does allow you to practice anywhere, whether that be rural or eventually if life changes in a metropolitan setting as well. So the life of a rural generalist, these are the pictures of well, that's not my backyard, but it is kind of my place. So in the life of a rural generalist is a really hard thing to describe because everyone is different. So I chose a whole bunch of the different MEs and I'm going to tell you about them. So we've got a GP obstetrician in Mudgee who is also running the emergency department at Mudgee. We've got a medical officer who has worked on the ships going to Antarctica for medical research. We have a GP surgeon who was previously working in Arnhem Land and is now all over the top end. We have a palliative care physician who developed and set up an inpatient palliative care unit in the far north coast of New South Wales. We have GPs working as staff specialists in paediatric departments around Australia. One of our team works at Gympie Hospital, but we also have GPs who are working in paediatrics in the office, working with kids with paediatric disability, ADHD and autism. That's my family. So I chose rural generalism because I wanted to make a difference. I didn't think I was going to be a rural generalist. I initially actually got into medicine to do aid work internationally. But then when I realised that rural generalism could provide me with that itch to help people, as well as have a lifestyle that could support me and keep me sane, it was the natural choice. A lot of people worry about going rural, thinking that you will be isolated. But if I can help allay that fear, I have never once been isolated in rural medicine. There is always mentorship and support. People want you to stay, and they will do anything to help you feel supported so that you will. There's a huge amount of job satisfaction. I've been in Cowra now for 3 years and I have helped deliver the babies of my friends, and I get to watch them grow up. And you can't beat that. It's fantastic. I have a unique skill set, but I also am able to drop my kids off at school in the morning or go to assembly if I want to. I don't have to worry about my work-life balance. And my kids get to grow up in the country, which I think is just great. So this was my last fortnight. I worked 8 days in the last 2 weeks. I worked in GP. I saw a patient who has decided that they are drinking too much, and I agreed. So I'm going to help them start to reduce their alcohol. I talked to one of my older patients about setting up their advanced care plan and what the next 10 years of their life might look like and what they want it to look like. I did some obstetrics. I was involved in a normal birth. I was also involved in a cesarean section because the baby wanted to be bummed down, so we couldn't have it naturally. I have worked in the ED. I sutured a laceration for a 2-year-old. I have also, as I said, taken a day off, well, a morning, because my kid got an award at assembly in kindergarten, so I dropped her off and I got to watch that. Can't say that I could do that if I was an obstetrician. And I also did teaching because I'm a medical educator, so I did some exam prep sessions. So, ACRRM Fellowship. It is about rural medicine. So we do encourage you to go to an MMM 2 to 7 location, and for at least 18 months of that, an MMM 4 to 7 location. Your training is meant to mould to you. If you have a passion for Aboriginal health, you can work in Aboriginal medical services. We do encourage some time as being hospital-based, which I'll talk about in a moment. So that's core generalist training, 12 months in a hospital, 2 years in a primary care, mixed with some ED and secondary care. And then we have the advanced specialist training, which is for us a given of your training, that you will have a funded place for at least 12 months, 2 years if you want to do surgery. And that advanced skill can be whatever you might like it to be, choosing from 12 different disciplines that range from procedural to academic. Everyone always asks, well, what can I do? So these are our different advanced specialist training options. You can choose, well, really whatever you want. I think that there's 2 ways to choose your advanced specialist training. You might have a place that you know you want to go to in mind, and you might choose an advanced specialist training discipline to help that area of need. Or you could be like me, and I knew that I liked ED in babies, so I chose ASTs in emergency medicine and obstetrics, and then I travelled New South Wales to find a place, a bit like Dr McKinnon. So you choose what your passion is, and rural medicine will find a place for you. Where can I go? I think we are sitting in Canberra today, so this is a metropolitan place, but there's heaps of places you can go which you might not have to travel too far to. This is a map of everywhere in New South Wales, and I just wanted to put it up there as an appreciation of there is just so many different accredited practices. And as part of ACRRM training, again with that flexibility, you might decide to do part of your training in New South Wales and then do part of it interstate, and that is supported as well. A bit more locally, so these are all of the accredited placements in and around Canberra. You don't have to go very far. Braidwood is MMM 5, and I think is what, 30 to 40 minutes from here? Oh, a bit more? Bungendore is also accredited, so yep. So you don't have to go far to do ACRRM training. So I was asked to talk a bit about career pathways, and really ACRRM can be whatever you want it to be. Perhaps the most streamlined pathway, so PGY 1 and 2, you can be in any hospital that's accredited to take an intern or a resident. So if you're in Canberra Hospital right now, that can count towards your training. Ideally, we like general rotations with paediatrics, anaesthetics, emergency medicine, obstetrics, and secondary care being encouraged. That's your foundational generalist skills. You might not like obstetrics, but you need to know about women's health, so we encourage 10 weeks in women's health. Then in PGY 3, you can start your ACRRM training, and that would be more the primary care aspects, doing your rural and remote training in either general practice, or maybe it's a mix of general practice, secondary care, and emergency medicine. Or you can decide to do your AST first. You will do a couple of years continuing those CGT requirements in rural and remote medicine and primary care. All rural generalists are primary care physicians. We are all GPs, and you need to have a strong foundation in that. Whether you do it first and then do an AST, and then PGY 7, you can be fellowed. But life is a little bit more messy than that. So this is probably a bit more of real life. Maybe you start in Canberra Hospital and you actually want to be an emergency physician. So you've done paediatrics and emergency. Then you did some paediatrics for your SRMO year. And then you did emergency medicine and you got on the program maybe. But PGY6, you fell pregnant and you had a baby. And you thought to yourself, hey, I actually think I need a bit more work-life balance. So PGY7, maybe you start ACRRRM training. We would give you recognition of prior learning for the emergency that you've done. Maybe your EDAST could be counted from that emergency medicine you've done. You've done your paediatrics, you've done your secondary care, and you start in Braidwood. You continue your ACRRRM training in Braidwood. You can complete your anaesthetics and obstetrics component while in a general practice. You maybe continue to do some locuming in ED because you really like doing some emergency medicine, but it's not all that you want to do. And then PGY9, you can complete your assessments and you can fellow. ACRRRM is there to help support you become the doctor you want to be. It's not about funneling you into a training program. Okay, so if you're interested, then we have 4 intake cycles, which basically means that you would feed into either starting in the beginning of the year or halfway through. So there's just a late application process in the middle as well. But I can't say it enough. If you're interested in ACRRRM, then please talk to us. We're here to talk to you today, but also please take a picture of the UR code, call us. People will talk to you about your unique situation. And if you're interested in ACRRRM and becoming a rural generalist, we will help you get onto that program and help find the pathway that's right for you. That's it.